Karnataka is among the 7 states specifically asked by the centre to make sure that there is enough oxygen for patients who are being treated for COVID-19. The demand for oxygen has, of course, multiplied many times over since the pandemic began, as oxygen is used in the treatment of COVID-19 patients. Karnataka is one of those states that has consistently shown that figures are in the top 5 when it comes to the daily number of fresh cases as well as COVID-19 deaths. The state has added a single day high of over 9,800 cases, while Bengaluru currently has over 1,70,000 cases. This has naturally put pressure on the oxygen supply in the state. Here's the full story.
Many of Karnataka's smaller hospitals and nursing homes are struggling to meet demands for oxygen in this era of COVID-19. Doing what they can to meet the massively increased demand for COVID patients struggling to breathe. COVID patients often require a much bigger oxygen supply than most other patients.
A lot of my friends are having hospitals, and they are definitely having a lot of problem because the requirement is very big, and by the time they go fill it and come back, it is a huge trouble. So definitely there is a very high demand.
A regular patient who needs oxygen needs only about 6 liters per minute. In a COVID scenario, the entire treatment is dependent on high flow oxygen levels. So the minimum starting point of oxygen will be about 15 liters per minute, and it can go up to 40 liters per minute.
The government says that right now there is no shortage of oxygen in the state. But medical professionals don't always agree and say prices of oxygen have sometimes almost doubled to as much as 40 rupees per cubic litre.
There is an acute shortage in about 13 to 14 districts in Karnataka right now. Yeah, pre-COVID times we used to get oxygen at 18 to 20 rupees per cubic litre. Post-COVID, now the demand also has gone up, and the regular suppliers are asking for a 40% hike in the prices.
The private hospitals want the government to cap the price of oxygen cylinders to help hospitals and the COVID patients they are treating breathe more easily. With Govind and Kumar, Maya Sharma in Bengaluru for NDTV.